Thank you very much. I just wanted to give a quick update. Governor Baker announced the Stop the Spread campaign that included Marlboro yesterday. Since then, we've been working on getting some locations to have the testing done. We've identified 2 sites where anyone can walk in and get tested. They don't need any prescription. They don't need symptoms. They can just go in and get tested. The Marlboro Hospital will be opening up testing Monday through Friday, 8 to 12. And AFC Urgent Care, 38 Boston Post Road West, down in front of the Apex Center, will be doing testing Sunday, Monday, Wednesday, and Friday from 11 to 4. We're anticipating at least 1 other site and possibly 2 other sites. Hopefully we can announce tomorrow or possibly over the weekend on Monday. It's being put together pretty quickly, where John Garside and his team has worked to reach out to get some testing sites for our residents. I did want to clarify some information that was put out yesterday that may have been a little misleading. We did have a very high test rate for positives back when we were starting this program over the last couple of months, with the hospital testing just people that did have symptoms, and the issues that we had at the long-term care facilities, especially Marlboro Hills, where our percentage was pretty high. In the last 14 days, we've dropped to 2.7% for a positive rate, so it's dropped substantially, and we continue to see that increase and get better as time goes on. And with that, I'll turn it over to John Garside, our health agent, to fill in some gaps there. John?
Thank you, Mr. Mayor. If I might just give a brief update of cases in the city. To date, we've had 995 cases in the city. 914 of those folks have recovered. We have 17 active cases in the city currently, 7 of which are at long-term care facilities. So like the mayor mentioned, we're happy to see that our long-term care and assisted living facilities have been able to get a handle on this epidemic, and that's really helped with some of the resources we've been able to provide and the state's been able to provide them. So thanks for that. 235 of our total cases have came from long-term care and assisted living facilities. So again, we're happy to see that number is not down to just 7 in the city. A couple other things, like the mayor mentioned, we're hoping to get a couple more sites on board, hopefully as soon as next week. mass.gov/stopthespread is where folks should go to get their up-to-date information. As we add facilities, they'll be listed there first. And we encourage folks to call those numbers, make an appointment. Most facilities will be by appointment only. So walk up or drive up without an appointment is always risky. So go to the website, mass.gov/stopthespread for up-to-date details. And we welcome the additional testing in the city. There's obviously a demand for it. And maybe this will help us get a handle on some of the asymptomatic spread that may exist out there, and a prevalence of some of these, the community spread that may still exist in some of our cities and towns. I would remind folks to continue to practice their social distancing and the wearing of face coverings as we continue to reopen here. We've made some great progress, and we just want to keep heading in the right direction, and I just don't forget what we've all learned over the last few months in regards to protecting yourself and others. That's all I have, Mr. Mayor.
Thank you. And a few more things. The beach, obviously, exciting time, and it's been pretty warm the last couple of weeks, but the beach is open for Marlboro residents. They are checking our IDs and as people pull in the parking lot, and the police have been great down there and helping out some of the kids that are running the parking, as well as the lifeguards. So that's open. Lifeguards are on duty. Bathrooms are open. We're excited about that. The 2 wading pools in the city, one at Hildreth School and one at Bigelow School, are both open. So there's been a lot of activity down there, and the splash pad down at Colony Park is also open. City Hall is open for appointment only. So if you have issues that you need taken care of at City Hall, just call the specific department and you can set up an appointment. The library, fire department, police department, DPW, and senior center, as well as our mobile housing, at this point are not open to the public, and we ask you to please cooperate with that. If you have questions, though, there are people available to answer any questions. Also, I want to remind everyone the Marlboro Community Cupboard up at the Walker Building on Main Street has been very active. If you do have needs and you'd like to go up there, just give a call in advance, 508-370-4902. And that's open Monday, Wednesday, Friday, 9 to 1, and then Wednesday evening from 5 to 7. And they could always use the help of donations if you'd like to stop by, or just send them up to my office and we'll forward them on. The community hotline, again, this is for non-emergency questions. Please give us a call at 508-251-5622, and that's 508-251-5622 for the community hotline for non-emergency questions. If you have an emergency, as always, call 911 and they will deal with that. And again, please go visit the city coronavirus response information hub on our website. Has daily information that we'll be providing. We're going to be cutting our notifications down to weekly, but the information will be coming from our health department. With that, we'll open it up for any questions.
If I could just ask you, sorry, I just wanted to clarify. You said for these new testing sites, people can make an appointment? Okay, and walk-ins are allowed, but you're not guaranteed?
Yep.
We're encouraging all our providers to do appointment only. Understanding some folks may trickle in. If they're slow, they may take a customer like that. But in the order of folks being able to control crowds and such, certainly call the provider's phone number or their website to make an appointment to ensure you're not standing in line.
And I talked to the mayor about this earlier, but I'd love to get your insight on this. What do you think led to the state naming this one of the higher hit areas like it did yesterday? Of course, the numbers is what led them to that, but how do you think you got roped into all of this?
So we've looked at the metrics since that came out, and you could argue there's a dozen towns that you could choose from to throw in there, certainly cities and towns. We're fortunate and we're glad to have the opportunity for additional testing. Do we agree with how they come to the numbers? Probably not, but that's not the issue. The issue is we're happy to have the additional testing capacity. I know folks want it, so I think we're blessed to have it.
And this testing is open to just residents or anyone?
It's targeting just residents. I don't think they'll turn you away if you're from a neighboring community, but we're targeting Marlboro residents.
And again, it's free of charge. There is no charge.
Anything, hindsight, I know the mayor said you guys have tested a lot in the beginning. It kind of dropped the past few weeks. Anything that you would have done differently when it came to that?
Well, testing's a little bit out of our control, quite frankly. So they test based on, historically it's been folks needed to be symptomatic. So this is an opportunity for folks who are asymptomatic to get tested. So you can only do what you have resources to do, and I think we tested everybody that had symptoms or was a close contact. As of the last month or so, close contacts have also met the requirement for testing, so we've been doing that. So I think we've done all we can do, and we look forward to the additional data as it comes in over the next month.
Anything else? Good? Thank you very much.
Thanks, guys.